Hi, parents. My name is Megan Robertson, and I'm a speech language pathologist by background, and I specialize in pediatric feeding and myofunctional therapy. And today we're going to talk about how to support your baby's oral rest posture, nasal breathing. All of this is super important for their development, their growth. Just don't worry, I'll break it all down in like simple, easy to follow, even if you've heard of these terms before. So let's dive in. So, what is oral rest posture? Oral rest posture refers to how your baby's mouth, tongue, and lips are positioned in order to support feeding and crying and babbling. If they don't have the proper oral rest posture, there's going to be some difficulty breathing, lack of jaw growth, which is going to be super important, and then stages for feeding and speech later on. What the oral rest posture should look like. The tongue should be up onto the roof of the mouth or the palate, like this. An easy way to check for that is if your baby is sleeping with their mouth closed and you're just gently going to open it and make sure that tongue is suctioned. It shouldn't fall down to the floor of the mouth. And then lips are closed but not tight, jaws relaxed. Then there's nasal breathing, and your baby should be able to breathe through their nose. And we'll talk more about like keeping the nose clear in order to eliminate that mouth breathing or prevent the mouth breathing. Why is nasal breathing important? Babies, when they're born, they just have this natural instinct to nasal breathe, and we want to keep it that way because it's going to filter some warm air. It's going to kill germs, allergens. There's better oxygen flow to the brain when people are nasal breathing. And it starts in infancy. A lot of us do mouth breathe, myself included, that I have now resolved, but we can eliminate all of these chronic issues from just starting day one in infancy and as they continue to grow. And then it helps the tongue rest on the palate. This is going to promote healthy jaws and airway growth because when the tongue is up on the palate, the tongue is a natural palate expander. We need to support the palate because the more narrow the palate, the more narrow the airway. And then again, mouth breathing leads to issues like poor sleep, feeding difficulties, changes with speech, and even facial development. So kids with a little bit like longer face or longer mid face, it's because of that chronic mouth breathing. How can I tell if my baby has so sorry. How can I tell if my baby has proper oral rest posture? All right. So like I was saying, if they're sleeping and you're able to gently open up their mouth. I've done it with my own kids and I still do it, even though they're 4 and 5, and doesn't wake them up. Hopefully your kid is not a light sleeper, because I have heard of clients say that, oh, I tried to open their mouth and they didn't like it. Ended up waking them up. So just being like really gentle about it, maybe when they've been resting for quite some time. And then during play, do they have their mouth open often? Are they just like, are they playing with you and just the mouth is open? And then with feeding, did they struggle with a latch? Were they clicking and popping off the nipple? Were they not having this like good suck, swallow, breathe pattern? So that would flag us that they probably have a low oral rest posture, or they just don't have like the greatest tone to keep that tongue up in the palate. So tips to help support the nasal breathing and the oral rest posture. So encouraging the nasal breathing as much as possible. Clearing the nose. This is a huge part. We forget that babies are very sensitive and we can spot the congestion. We think like, oh yeah, there's boogers in there, or they sound kind of, you know, there's some sort of restriction, but there's the tiniest little bit of inflammation in this area of the nose that can be prevented with consistent saline spray. And there's an X Clear brand, um, small little bottle. You don't even have to like spray it in their nose. You can just have, if they're on their back, just bloop, bloop right into their nose, and that will help to clear them up. You could also do the saline spray and then maybe wait like a minute and go ahead and suction their nose, because it's going to break up some of that inflammation and congestion. And then just pay attention to allergies. If all of a sudden they are starting to eat, or you change a few things in your diet, they're just not able to handle your breast milk, something just feels off, it could be a food sensitivity. And then we want to promote the tongue up posture. Tummy time, super important. This is going to strengthen their neck and jaw muscles, which then is going to help support the tongue movement. And then tongue taps. So you're going to gently tap the tip of the baby's tongue and with a clean finger to encourage that upward movement. So kind of, we want as much elevation as we can. And then supporting lip closure, you might need to gently press up under their chin, and you can actually tap right underneath their chin, this muscle, because if you push up, it's going to push that tongue up onto the palate. You might have to do this more times than you would like, but you're going to save yourself a lot more medical issues like chronic ear infections, enlarged tonsils and adenoids. The list goes on. I could go on and on about this. Anyhow, and then optimizing positioning. So with feeding, you might need to do a little bit more upright position to help support that. Otherwise, the sleeping position, sleeping on their back, more neutral position as well. The sleeping part, I do hear a lot of times, my baby sleeps on my back, and then they're like, and then they have to push up. Go ahead and push up under their tongue. So now they're having the best oral rest posture, and maybe have them go on their side. And this might also lead to an open mouth posture, but just do the best that you can. You can't go into your baby's room and check every hour if they are nasal breathing versus mouth breathing. Seriously, you just have to do what you can. If you're not seeing the results that you would prefer, then that gets me to when to seek help. So if your baby is constantly mouth breathing, they're struggling with feeding, they're snoring, this is a huge red flag. Babies can start snoring early just because those tonsils and adenoids are getting larger from the chronic mouth breathing. So we need to eliminate, is there an airway obstruction that's leading to the snoring? Super important. So we might have to get an ENT involved. If it's more of like a feeding coordination issue with the tongue, speech therapy like myself, or occupational therapy, any pediatric feeding like specialty, this is where this is going to be very, very helpful. And then just a quick checklist to go through, kind of have it in the back of your mind is, are my baby's lips closed at rest? So just, when they're not really doing anything, are their lips closed? And then my baby is breathing quietly through their nose. Is there some congestion? Can you hear more like heavy breathing while they're feeding? That would also be something to think about. And resting their tongue up on the palate. And then are they struggling to breathe at night or experiencing some snoring? So if your answer is no to any of these, don't worry. These are things you can work on with the support of a pediatric feeding therapist with a little bit of myofunctional therapy background. There's exercises that are very helpful to help promote the best oral rest posture and nasal breathing, but it just is like a team effort there is some hesitancy with parents. I don't need therapy, like all this, just have a couple of visits. The babies, especially, are so resilient. Maybe they don't need to be seen a whole bunch of times for visits. And then I have some references. I would love any and all feedback when it comes to this type of information. All I'm here to do is just educate, answer any questions. I'm doing this because I was that mom that struggled with nursing and some feeding. Then it developed into some feeding issues when my kids got a little bit older. So just helping to help others because infancy is such a good place to start.